Hello, everybody. It's Dr. David Janarious. I am obviously doing another recording now, and I was actually about to do my kind of daily video, my riff of the day, where I just play like a random riff from some of my favorite bands and artists. And I think about it, this must look incredibly random because my other videos are all about medical content. So I I wonder what people think when they see just random videos of me like playing music and probably wonder why. There is a reason to it. It's not just because I like music and I like to show off. I am an ApoE4 homozygote. This means I rolled the genetic snake eyes when it comes to dementia risk. People with my genotype, we are the highest risk for, we're amongst the highest risk for dementia. In fact, it's 16-fold higher than what it is for the average person, right? So some may say it's almost an inevitability. And unfortunately, when you have the ApoE4 gene, if you carry two copies of them, dementia tends to set on earlier. I talk a lot about prevention with my patients. And one of the things that I check in virtually all of my patients when they first join me is I assess their dementia risk. And part of how I do this is by checking an ApoE genotype. ApoE is the main genetic marker for Alzheimer's risk in the general population. So, there are three different ApoE genotypes. There's 2, 3, and 4. 2 is a good one. If you get a copy or two copies of 2, you have the lowest risk of dementia. 3 is what the average person has. It's the most common genotype, and we basically consider that like sort of the baseline risk. And if you have the 4, that increases your risk with each copy. So if you have one copy of the ApoE4 genotype, your risk is roughly fourfold increase over the someone who has the ApoE3 genotype. But yeah, in my case, I have 2. And obviously, when I first got the news, when I first, I actually tested myself because I kind of put myself through the same protocol I put my patients through. And, it was like in the short term, it was pretty devastating. Like for about a week, I remember being real sad. My wife, who's a neurologist, was obviously really sad. But, at some point you move on and you think, well, what can we do about this? And there's exciting meds out there that, kind of showing some promise in early Alzheimer's, drugs that are meant to actually clear away the plaques that form in the brain. But, the benefit to patients with Alzheimer's are modest at best. There are ongoing trials that are enrolling patients to actually look at the question of what if we treat people at high risk before they develop symptoms? And of course, I'm excited to hear that. But obviously, although I'm hopeful that something new and improved will come out when, it's my time, I think it's important that we talk about the things we could be doing in the short term. And this is worth a whole other video on itself, in and of itself. But a couple big things: exercise, daily exercise. When you exercise, you produce a chemical in the brain that helps sort of preserve those brain cells. Sleep is incredibly important, reducing alcohol consumption, smoking. But the other thing that can really, really help is actually building cognitive reserve. So generally, as with anything, once the decline starts, it really depends on where you started, right? So just imagine physical decline, right? If you reach your 40s and you were an athlete and you continued to train and condition, like, not necessarily as intensely as you were when you were playing competitively, but with the intention of maintaining, your decline will happen. You're eventually, hopefully, going to make it to 70s and 80s. You're not going to be performing at the level you were when you're 40. But that decline is going to look a lot different than someone who is making the decline from being sedentary at the age of 40, right? And, I always say in medicine, like one of the interesting things is you see, 50-year-olds that look like they're in their 30s and 50-year-olds who are 30-year-olds who look like they're in their 60s, I mean, you have a big say in how you age and the rate at which that decline comes. And for me, obviously, I pay attention to the physical decline. I speak a lot about the importance of exercise with my patients and in my recordings. But, in terms of mental decline, how do you prevent that? Well, part of it is getting educated, right? And luckily, being a doctor by definition, I have a doctorate level of education, so I'm kind of starting off there. But I think it's important to teach yourself new skills, particularly hard new skills as you age, right? Because that will also kind of help build up that cognitive reserve. And in fact, there was recently a study that was published that showed that people that studied music as adults had a 30% 30% decreased risk of developing dementia because you're just, every time you teach yourself something new, you're releasing chemicals that help kind of strengthen the brain cell connections and help preserve the ones you need, right? So, music is classically considered to be something that is hard to learn, right? Because there's a lot to it. There's, not only the physical technical aspects of playing your instrument, which is a skill in of itself, but there's also the mental side of it, learning how music theory works, learning to read notes, which I haven't done yet, but I do actually have a pretty good understanding of music theory, which helps. At one point I will learn to read, but so this is kind of part of my it's sort of a medicine for me, right? It's how I preserve brain function, how I prevent Alzheimer's disease. And also, I enjoyed it's fun, and it is challenging, right? And I think that's another aspect of doing these kinds of things that I think is important. You see so many people that as they age, they're the same person at the age of 40 that they were when they were 25, and they're the same people at 60 that they were at 40. Meaning, they get stuck in their ways. They don't want to learn new things. That is incredibly harmful to you. Again, it just, on so many levels, dementia risk aside, in general, just how you feel, I think, when you get stuck in a rut is bad for you. So I like to break out of that rut by doing hard things. And so guitar is a hard thing. I already know how to play the bass. I would consider myself a reasonably okay bass player. I hate to say that I'm good. I think no one learning an instrument ever wants to say they're good at an instrument. I'm certainly no less Claypool or Geddy Lee. But yeah, could I hold it down in your average rock band or whatever? Sure. So I just wanted to kind of switch that on over to guitar, which is, some consider a more difficult instrument. I actually think it's easier than the bass personally, and that's going to, hopefully that'll spark a whole internet debate because most people would disagree, but I think most people don't know how to play the bass. But yeah, so guitar is a sort of new challenge, and my goal, the way I was planning to kind of master this instrument was just sort of learn a new and challenging riff every day, something that kind of stretches my brain and my hands to do new things. When you see these cuts of me playing random 70s music or whatever, know that I'm not just showing off, though. I'm kind of trying to do that too. Sometimes not so successfully, as I sometimes butcher the riffs I'm playing. But what you're really watching me do is you're watching your doctor take his medicine. So I hope that explains it, and I hope you found this little talk informative, and I hope you enjoy the next riff that comes out. I enjoy doing this as always, and I'll see you next time.